Now joining us on Studio 2, as mentioned earlier, is Victor Ngani, the chairman of Kenya Medical Practitioners and Dentists Union, who is going to help unravel the impasse surrounding the health sector. Okachi.
Well, thank you very much, Munene. And indeed, the health sector is sliding into a standstill, and the patients are suffering. And as well, we've seen it has been turned to a tug-of-war between the minister and the unions representing the doctors. Welcome to the studio, sir.
Thank you very much.
And now, first things, Bwana Daktari.
Yes.
What do you take on the minister's threat?
Well, the minister's threats are extremely unfortunate, and they're reminiscent of the years when Kenya was a one-party state. And we want to say this categorically. As doctors, those threats mean absolutely nothing to us. To the actual threats, he has threatened to employ 1,000 doctors. We are very happy with that, because that is in fact part of our recommendations in the Musimi report that he has not read. We have such a big shortage of doctors that if you could employ for us 1,000 doctors, I think it's everybody's delight, even the entire country, to have 1,000 more doctors. Our only question is, where are you going to invent these doctors from?
You said it's going to get them from Uganda.
You know, the minister is completely clueless about what happens in the health sector. There is no you're going to get a doctor from Uganda. They have their own shortages. And the process of getting to work in Kenya, you must first do a one-year internship before you can even be registered or even considered. So unless you're talking about which doctors, there is no chance you're going to get more than 50 doctors. Yeah. Now, the second threat that has been actually quite effective was the business of stopping salaries, which we think he has done. And this strike so far has not been about money. But if he goes ahead and stops the salaries for doctors, then you're going to reduce pay demands to compensate our doctors. Now, our problem is the minister is very busy chest thumping, and he's quite arrogant and has refused to meet us. It's interesting that he highly respects the doctors in the United States and commends them and treats them with respect. But the Kenyan doctors, he treats with contempt. And
maybe before we get into that, the minister was very clear by submitting that the government of Kenya does not have in its budget money to pay the self-sponsored registrars. Is it true, or is it true that you are demanding on things that are not feasible?
You know, this budgetary provision should have been made because the report was given in February. It's because of complacency and a lack of seriousness in the ministry that this report was not implemented. This is a case of ending slavery. If you told me today that there's no money in the budget to end slavery, I would be really disturbed. We have 250 doctors who historically have been working for this institution without pay. And I just heard the minister claiming that it's the same as doing geology. You know, it's a clear lack of understanding. In his whole 4 years as a minister, he has never visited the registrars. He doesn't know what they do. These are people who work. They're professionals with 2 degrees. They're the second highest ranking doctors in the entire chain. They work between 60 and 80 hours a week for no pay, absolutely. Now
but the minister is saying that the government does not pay these people.
That has been the problem. Yeah. And it's a problem you have raised for the last 1.5 years. The problem is, as you've seen, dialogue is not an option the minister is willing to listen to. He has his own ideas, and that idea is that the same work that a geologist does is the same work that a doctor does, and therefore the rocks and the patients are the same caliber. It's extremely unfortunate, and I think the sooner the minister realizes that arrogance is not a virtue, it's a vice, the sooner he realizes that arrogance in the face of a doctor strike is costing lives, the sooner we may get a solution. But at this rate, we are headed nowhere.
You as a union, do you think your approach has been effective? Or rather, will it be effective in the end of the day?
Well, a doctor strike is not to be gauged by its efficacy. It's something that is supposed to be looked at by the statement it delivers. An effective strike means patients are dying. Okay, unfortunately, to some extent, we've witnessed this a bit, and it's a really unfortunate situation. We want to resolve this. We should never see a doctor strike. Unfortunately, we are left with no alternative. And I want to tell you this. Whatever it is that we have presented has been quite reasonable, and if the ministry will not listen to us, we'll be on strike until those are solved. The people who want to have these doctors leave this country.
Yeah, and Bwana Daktari, we know that the minister has said whatever he has said, and you know this all issue is being turned to a tug-of-war between you and the ministry. And now we were asking you, like, do you think the minister, by saying that you've shifted what your main goal of striking was, do you think he was right by saying that?
I always have a problem following what politicians say. They speak too much politics, and they are very free. They freely mislead people. Well, dishonesty is part of we have been very clear about our demands. We have said implement the Musimi report, end the slavery for the people who are working for free, 250 people work for absolutely free every day, and account for the 200 million that has disappeared, was released in Treasury in January, and has not been given. We have said very clearly, If they go ahead and stop the salary for even a single doctor, we are going to introduce pay demands for the remaining 2,600 doctors who are currently on strike, and not because of pay. So those demands are very clear. We have not changed them, we will not change them. The politicians can come and say what they want to say, but that's the fact as it is, and it will not change.
And towards unlocking this deadlock, because you know the people will be suffering are the patients, and it's when it gets to that, it can be in the worst situation, rather the worst scenario that no Kenyan would wish it to go to that extent. And now the minister is saying he's only ready to talk to you people, but in the industrial courts.
Well,
are you ready for that?
As he says, we actually went to court on Monday. The AG was not there. So you're supposed to have been discussing something in the courts, and the government side decides not to attend court. You know, it's very unfortunate. Now, a doctor's strike is something that should not even last a single day. While the minister is waiting for court process that may take 2 years, who's treating the patients? You know, 85% of Kenya's population can't afford the private hospitals in Kenya, let alone go to California for medical treatment at a cost of 100 million per year, as the ministers get. Now, it's unfortunate that this is not being taken seriously. It's a real tragedy. But for the Mwananchi, who's not rich enough to be making calls all the time, the minister has the responsibility to take healthcare seriously. He's drawing a salary as a health minister, and health services are not being provided. What is he doing that salary for? And you're asking him, please take responsibility, show leadership, drop the arrogance, come to the table, let people talk. But as long as it's just thumping, I can guarantee you there'll be no solution. And unfortunately, Mwananchi is going to continue suffering. We are really appealing to the public and every person who has a heart. A doctor's strike should never happen. This is because government traditionally enters into an agreement, and then 6-7 months down the line, they throw away those agreements, and then you have to go back on strike again just to be heard. And it's very unfortunate it's happening this way.
And you're talking about the agreements. The minister was maybe faulting you people of not understanding the return to work formula of 2011. Maybe could you give some clarity on that?
Well, I would be quite surprised if the minister knew that agreement more than I did. I'm sure he doesn't. Well, I don't think he does. One of the things is 200 million was meant to be given for the payment of fees for postgraduate students who are studying to become professionals in various specialties. And this money left the treasury in January and didn't get to the university. They have been given letters to vacate learning premises, and some of them didn't get the certificates so that they could be promoted in the various workstations. Now, it's a very clear question. Money left treasury, didn't get to university. Where is it 9 months down the line? That's one of the things you're asking. Secondly, we agreed it's pointless to just pay doctors without improving infrastructure. So you formed a task force, which sat for 1.5 months, the Musimi task force, that recommends that you build a referral hospital in each and every county, put an MRI, a CT scan, an ICU, bring drugs using a revolving fund of 15.9 billion that includes all anti-cancer drugs.
But he said he's ready to do that.
The minister did not read that report until perhaps this month after the strike. Now, this report was completed in February. Nothing has been done to implement it. So when he says that the return formula has been implemented, I really wonder what it is he's talking about. The same strike had the same issue of registrars, ending slavery. And we agreed that, okay, it makes sense, they work, they be paid, and now the government has done a complete about turn.
Yeah, and now you from where you're seated at the union, like, do you think by tightening the rope, you will be maybe doing justice to the public as a whole? And do you think by doing that, you will earn what you are demanding from the government?
Well, if we could influence policy that makes meaningful healthcare be provided in the public sector, I think it's good for everybody. It's unfortunate that the means is actually in the short term a tragic means. And my prayer is that even tonight we could end this strike. Yeah. But I want to tell you that the kinds of roadblocks you have met at the Ministry of Medical Services are astounding. We have the same people who've presided over this dilapidation over the last 10 years, still giving the advice that professor listens to. He's never listened to us. He doesn't even know what we're asking about. He doesn't even know what the problems and complaints are. He doesn't know what elements of the trend. He has never listened to us. He has never sat down with us, and he's refused completely.
Yeah. And now, maybe because of time, what would you maybe suggest as the solution to all this impasse? Very shortly.
Number one is dialogue. Yeah. To drop the hardline stances. This is not about self-terming. It's not about pride. A leader is supposed to come and act decisively.
Are you ready for the dialogue? We
have been ready from day one. We have actually gone to other meetings with the people who don't have decision-making capacity. They even presented proposals to end the strike, which the minister trashed. So it's unfortunate. We have tried. And at this stage, we are saying, okay, you do as you please. Go ahead and try doctors if you want. We'll wait to see which backward you're going to get them from. But the doctors of KMPDU In fact, they'll get the message very clearly tomorrow, because you're having a delegates conference, and a very clear message is going to come out of that.
Okay, thank you very much,
Thank
Dr.
you,
for
sir.
having joined us.
Asante sana.
Well, viewer, as you've heard from Dr. Victor, it's all about dialogue, and it's time the country takes leadership, or as pertains to this matter. We've seen the teachers' strike being resolved, and we would wish also the doctors' strike to be resolved.